Depression. Introduction.
The difference between feeling sad and being clinically depressed is that when you feel sad, it will eventually go away. If you have depression, the sadness does not go away.
Select true or false.
Correct. In a clinically depressed patient, the sadness does not go away. If a person does not care to have sex, it is a sure sign that they have a depression problem.
Select true or false.
Correct. If a person has little or no interest in companionship or sex, it may indicate depression. However, this symptom does not always mean a person is depressed. Only adults can have depression.
Select true or false.
Correct. Children can be depressed too. A depressed child may refuse to go to school or may get into trouble at school, among other symptoms. Women are more likely to be clinically depressed than men.
Select true or false.
Correct. Statistically, the number of women who experience depression is twice as high as that of men. However, men are less likely to report depression and usually mask depression with more socially acceptable habits, such as working excessively long hours. Neurotransmitters are chemicals in the brain that help brain cells communicate with each other.
Select true or false.
Correct. Depression is always triggered by a sad event.
Select true or false.
Correct. Some people experience depression without any triggering personal event. Antidepressants work immediately, so if results are not noticed within 24 hours of starting the medication, you should contact your doctor.
Select true or false.
Correct. It may take weeks before depression medications work. Therefore, it is important to keep taking them and to not get discouraged if you do not notice results immediately. If you drank alcohol or used drugs before being diagnosed with depression, it is okay to continue drinking or using drugs while you take antidepressants.
Select true or false.
Correct. Most antidepressants do not mix with alcohol or illicit drugs. Therefore, it is very important not to drink or do drugs.
Thank you for using Explain.